Hello, Dr. Sean McCorkle again here at Summer Creek Animal Clinic. Last time we walked through what a dental procedure or a comprehensive oral health assessment and treatment looks like. And so now I wanted to just go through some of the things that we see on a regular basis when we're doing these really high level dental procedures in order to address all of the disease, infection, and inflammation and pain that's in the mouth. So one of the things I wanted to start with is periodontal disease, because this is by far the most common thing we see in the mouth. And like I said before, that is infection and inflammation under the gum line that is destroying the tissues around the teeth. And so this is a dog skull, and you can see here the teeth on the upper jaw and then down here on the lower jaw. I want to hone in on this tooth right here. As an example, this is a really big lower first molar that is involved in chewing in the back of the mouth. And you can see this is a healthy dog jaw, and you can see all of the bone right here to where you can't see any of the root structures. This is the crown, or the part of the tooth that you can see in a normal dog, and then everything here underneath the bone is the root structures. So in a normal healthy dog, you want to see the bone covering up the root completely. And so in this dog here, you can see this is a dental x-ray of this tooth right here. And the periodontal disease is extremely severe in this case, to where the bone surrounding these two roots is almost completely destroyed from the infection and inflammation that's been going on under the gum line for some time. And so all of this void around these roots is infected tissue. And so if this jaw here was this pet, all of this bone here would be completely destroyed. And that's been going on over a long period of time, and that is a very, very painful process and tremendous amount of infection in this dog's mouth. And this is how it was throughout the whole mouth. We ended up removing most of the teeth in this situation, because when it's this extreme, there's nothing we can do to remove the disease without removing the tooth. And so that just basically, when we do the procedure, we're looking at all 42 of these teeth in the mouth individually and making decisions on what do we need to do to remove the infection and inflammation in the mouth. Can we do that with just really detailed cleaning above and below the gum line, or do we need to take more drastic measures, like in this case, extract the teeth, with the goal of always removing all of the disease in the mouth. And that is one of the most common things I see that is overlooked if you're not practicing a high level of dentistry. The stuff under the gum line can easily get overlooked. One of the other common things we see in the mouth, primarily of dogs, but in cats as well, is broken teeth. And almost every time that client is not aware of it, because dogs and cats do not show symptoms of pain as obvious as you and I would. And these teeth in the back of the mouth are the ones that are most commonly broken in dogs, because they're the chewing teeth. This really big upper fourth premolar on the top is the most common. And those fractures can be either uncomplicated or complicated. Uncomplicated fractures mean that the enamel is broken off, but the pulp, where the nerve and blood supply is not exposed. Oftentimes, those uncomplicated crown fractures can be treated with what we call a bonded sealant, where we just seal the underlying dentin that's been exposed so that it's not sensitive any longer and their bacteria can't get into the tooth any longer. Most of the time we can do that. If there's evidence of infection, then the tooth has to either be removed or root canaled. A complicated crown fracture is when the pulp chamber is exposed, the blood supply and nerve supply, and that tooth is 100% going to be dead and get infected. And so that tooth has to be either extracted, which is what's done the vast majority of the time, or root canaled. And the root canal requires referral to a board certified veterinary dentist, which we do work closely with one in the Metroplex that we can refer to if you are interested in that kind of scenario. So those are two of the most common things we see in dogs, and we are equipped here to deal with that, to diagnose that, as well as address that to again remove all of the infection, inflammation, and pain in your dog's mouth.